day of your mock board exam, I will provide you with this candidate exam packet. This is very similar, if almost identical, to the credits exam packet that you will receive from them. So we will talk about the timing here in a second. So we're going to skip forward to that. You need to make sure on each page that you're putting your candidate number. For our purposes for mock boards, your candidate number is your dental hygiene number. For example, my number in dental is where you're going to fill this out with your candidate number, the date. You do not need to get patient signatures for your mock boards. However, you do need to get that if you are doing a patient-based exam for credits. You will use this health history screening form. And so this is the form you are going to use. You're not going to use the usual form that you use in clinic. This is the form that you will use. It will be in paper format. There is a second page here. You do need to get the patient initials and your initials and the date. If your patient requires a antibiotic prophylaxis, you're going to put that there. This part is your start and finish time. Your evaluator or instructor will note that. You do need to put your candidate number here. Anything that's grayed out are things that don't pertain to us in the mock board setting. This again is completed by your examiner. We are going to write in the teeth numbers. This is actually going to be 2 teeth that we will assign for period charting. That is going to be one of these teeth or within the quadrant that you are scaling. You do have an anesthesia form. You need to get this signed right here if you are administering your own anesthesia, which you all should be for your mock boards, to obtain authorization to get local anesthetic from the lab. For mock boards, that is just a clinic instructor. During your actual board exam, you must get the signature from Dr. Myers. Now, during your actual board exam, if you are not able to get your patient numb, it's just not working. Who cares what the reason is? It's not working. You're going to go get Dr. Myers. He's going to give your anesthetic for you. You're going to move on, okay? But just note that you do need to get this signature. And then you need to fill all this information out before your final evaluation, right before checkout. This is in regard to your final evaluation. All this paperwork that you are going to be utilizing needs to be kept on the clean second shelf of your cart. Okay. This is the EI form that you will complete. If you check within normal limits, there cannot be anything written up here, vice versa. If anything is written here, do not check the within normal limits box. If you have a check here and words here, it's an automatic points off, right? Make sure that you look over this. This is on the back wall in clinic. They ask for very specific, significant findings. So some of the things that you know in clinic, you are all very, very thorough with your EI exams. I love that. You may not have to be concerned with some of those things, right? Make sure you look over this. It's 2 pages. You will be only probing 2 teeth. This is where you write the tooth number down and make sure that the surfaces that you probe match up with this where you write them down. Now here's where we have a slight variation of the mock board exam, whether you are patient-based or you are doing the mannequin-based exam. If you are doing a patient credits exam, you will use this treatment selection form. Put your number up here. You will mark all impacted, missing, and unerupted teeth in the whole mouth, not just where you are planning to treat, all the teeth. Now, You have certain requirements for clickable calculus. However, you are only going to submit specific teeth numbers, not the surfaces. Your calculus has to add up, and we will talk about those qualifying clicks in just a second. However, you are only going to submit teeth numbers, right? You need to have at least 6 tooth numbers. There has to be calculus on that tooth somewhere, at least one deposit. You are going to submit a alternative treatment selection or submission. So you will check that box and put your alternative treatment submission. Now, here is where your minimum requirements are located. You need at least 12 surfaces of qualifying calculus, not grainy, qualifying, clickable, discernible calculus. At least one surface of calculus has to be present on any of the minimum 6 teeth that you submit. Most students submit more than 6 teeth or more than 12 surfaces. So you might have only 6 teeth, but you have clearly more than 12 surfaces, right? It's not bad to have a few extras. You need to have at least 3 surfaces of qualifying calculus on molars. So your teeth, you need some molars in there. Remember, you can select teeth anywhere in the mouth for this exam. It is ideal if they are near each other. At least 8 of the qualifying calculus deposits need to be on posterior teeth, so molars plus premolars, and you need at least 12 surfaces again. So of those 12, you can have a max of 4 deposits of qualifying calculus on anterior teeth. You may have more than 4 deposits of calculus on anterior teeth, but you can only count 4 of those max towards your 12 surfaces, right? So review what your minimum requirements are. Very similar to our final last semester. However, you are only submitting the tooth numbers. You are going to complete a calc detecting. You're going to use your calc detect dry erase board, and you are going to calc detect on that. You can calc detect other teeth. I don't care. As evaluators, we're only going to pay attention to the teeth that you selected. The reason for that for this exam is that does not exist in credits. However, we don't have the computer system that does all the mathematical algorithms for the calc detection part. So we have to do it the paper way, the old way. All right. So you do need to calc detect. Make sure you've calc detected at least the teeth that you are submitting so that we can do the calc detection points. If you are doing the mannequin credits exam, you are not going to select specific teeth. You are only going to select one quadrant. Now you do need to make sure that that quadrant that you choose has 12 detectable deposits of calculus at least, right? But you are going to select an entire quadrant. You will mark all impacted, missing, and unerupted teeth. You need to make sure that quadrant has at least 1 molar and some premolars. You got to have some posterior teeth in that quadrant. This isn't a sextant, it's a quadrant. You can be missing a tooth in the quadrant, excluding wisdom teeth, of course, from that scenario. They don't matter. I don't care if your patient has wisdom teeth or not, but you can be missing a molar or a premolar, right? Or potentially 1 anterior tooth. But you need to have a pretty full quadrant, but you are going to only select 1 quadrant. You also are going to do a calc detection sheet of at least the quadrant you select and of also your alternative quadrant that you will select, because you will have an alternative selection. All right, so then you are also going to calc detect on your calc detection sheet, which most of you are going to do that anyways because you have to do it in order to figure out where you're going to treat. Okay, so that is your candidate exam packet. We are going to take a quick break, and then I will do a separate video talking about the timing of your exam.